Hello, good evening everyone, and welcome back to my mental health and crime channel. My name is Huda London. Please like, share and subscribe. One of the main reasons that I started this channel was to spread awareness for the missing victims, for people who are suffering of mental illness, mental health rights, to spread awareness in general. Today, I would like to go back and talk about the case that I've been working lately on. It's about a 31-year-old Florida woman called Beatrice Bijou. Beatrice owns her own law firm. She has a master's degree in law and she passed her bar exam. Since 2016, she opened her own self-employment law and injury firm, and she's been working hard on her firm. She's a very hard-working woman. What basically happened was on the 2nd of February 2022, Beatrice Bijou drove her SUV into a crowd of people and injured 4 people. Luckily, nobody came into serious harm's way. 1 person was taken to hospital and the other 3 had minor injuries. Beatrice tried to leave the scene, allegedly, and I've seen in another report it says that she took herself to the police station. While she was on her way to law enforcement to the police office, police station is headquarters, the police stopped on the way. Backup came. They drew out their guns. They made her come out of the car, but they handled her very gently. Obviously, I can understand law enforcement's job. Sorry, it ain't easy when you don't know what you're dealing with or who you're dealing with, since the person already used their SUV vehicle as a weapon to run over innocent people just doing their grocery shopping on a Monday or Tuesday morning. The first thing that Beatrice said to law enforcement was that she heard voices telling her to kill all those people and then to kill herself. She was clearly having suicidal thoughts and she was clearly hearing voices. As a licensed cognitive behavior therapist and a mental health counselor, I am aware of the symptoms of both bipolar and schizophrenia. We did not get much of her diagnosis, and there's not much written up on the media either, but she clearly stated that she suffers of bipolar schizophrenia. So I believe not only does she suffer of 2 mental illness, one to do with mood, that is bipolar, and schizophrenia is more severe with dementia, with delusions that makes them hear voices and see things that usually aren't there. They get into hallucinations and delusions. When they're having a active schizophrenia, when they're in that stage, it can be many things, many symptoms that you can see, and especially the changes of speech and the irritation, paranoia, and such things trigger really hard. It really triggers badly on them. So coming back to Beatrice is voices that were telling her to kill the people and then to kill herself. I do believe if she's suffering of schizophrenia and bipolar, like she said, I don't see any reason, honestly, for her to be lying about her diagnosis, because she clearly gave her doctor, her psychiatrist, his details. She said that she believed her doctor's name is Dr. Yummy, and his descendants are Nigerian. She even gave the location where he works. The police officer clearly asked her when was the last time that he saw a psychiatrist, and Beatrice said she believes it was in 2019. Like we are aware of, we've had the COVID epidemic that hit hard in early 2020, late 2019. So I can imagine that it was extremely a change for all of us, and it must have been a challenge for her to continue going to a psychiatrist. We have heard the integration, the police statements that both Beatrice and her fiance has given the police, and the fiance did not know what Beatrice said, but he said that when the officers asked him if they believe that Beatrice has a diagnosis, he said yes. He knows that she's bipolar, and she knows that he said she's bipolar, schizophrenia, and she uses different kind of medications. He even said some of the medications name, and I checked it and compared it to the statements that Beatrice was giving the police, and it was the same medications. It is bipolar and psychosis medication. So clearly, this seems to be like a mental health patient, and in the police interview, you could clearly see that she couldn't sit. The symptoms I could see was paranoia, anxiety, irritable, mood swings. You could clearly see her talking low, and then she just gets up and says that she wants to go and starts threatening them. She was threatening the officers, saying, if you don't make way for me, then I'll have to kill you too. That's the time they put her handcuffs from the front. She had her hands in front on her lap. She had it in a comfortable position, but they put it behind because of the threats, which escalated the whole situation, which I can really relate to. But those voices are definitely the reason she's saying such things. I don't really believe that she was aware of half of the things that she's saying. She hears voices talking to her. That is one of the reasons I do not believe that the interview was conducted in a professional manner. I believe that law enforcement should have immediately called a psychiatrist on the scene, called the attorney, even if she doesn't want an attorney, because you could clearly see how confused she was. Once she says, I don't want to talk without my attorney being present, and then the other time, when the officer starts the interview, Beatrice says, no, I want to stop there and I don't want to continue. I need my attorney. So obviously, many people would say that she's playing with the police, or she's playing with law enforcement, and she's wasting their time. But people need to be mindful that you're dealing with a person who's not in their rational mind, who do not have rational thoughts. They're dealing with irrational thoughts. These people have voices talking in their heads, giving them orders, telling them to do something, and they don't even realize half of the time what they're doing. So besides her having the schizophrenic part, that she's getting the hallucinations and hearing voices and seeing things, we're dealing with her bipolar 2, whether it's bipolar 1 or 2. It depends if she's in a manic stage, where she's grandiose and hyperactive and just full of energy, or if she is in a low mood state, hypo, hypo, sorry, sorry, I got stuck there. I mean, basically bipolar 2. So if she's having those symptoms, it is a bit milder than bipolar 1, but at the same time, that is still a person suffering of mental illness. And we could clearly see the whole interview with the police. You could see that the woman could not sit still. Her hands were shaking, she was trembling. You could literally hear her breathing so deeply every second. She was trying to struggle to breathe kind of for oxygen. And I really do believe when she kept on getting up and searching for the officers and saying, leave the door open and let me walk in the corridors, because she's claustrophobia, that I really do believe. So there's many of things that the schizophrenia part and the bipolar part, the anxiety, paranoia, depression, all this has a lot to play in. And she herself said that she's supposed to be on regular medication, but she's not been using her medication the way she's supposed to be using it, and that obviously can get a person to lapse again, basically, and come to that bad negative circle again of starting to hear the voices telling them to do violent things, or that they start seeing things that people do not usually see. So it is scary. You can imagine it's scary for us to understand. So imagine what the patient themselves are going through. She even said that she has a gun, but her brother locked it up in a safe because she's threatened to use the gun to kill her and her family before. So this is a person this is not the first time she's been getting suicidal thoughts compared to the way we see it. She even said, I think I haven't recorded that part, I need to upload that too. In the next part, she says that she has a niece who's 4 years old who partly lives with her, and she said today she felt like killing her niece. So I don't even understand if her family are aware of her diagnosis, which she said they are aware of. They shouldn't be letting her be around a 4-year-old child. That is really concerning, because a person with schizophrenia without taking the medication, and if they're on drugs and substance and alcohol, it just can make the situation completely bad. A good example of bipolar psychosis is Darlene Brown, the guy who allegedly is accused of the murder of 4-year-old Cash Gernon. I hope Beatrice Bijou gets the right that she deserves. As a mental health counselor, I take mental health rights very serious. I do understand, even if they're patients or not, they shouldn't be going around and driving loose and trying to kill people. I do not absolutely agree with that. That is completely wrong. But I believe that we as a community, we as a society, we as clinical workers, as therapists, whether it's doctors, psychiatrists, and everyone in the community with different jobs, everyone has a duty, I believe, to make sure that we put the right people in the government and pass the right bills, so that we make sure that people like Beatrice gets their fair share of their rights in their court and in the law. And at the same time, the people like Beatrice, if they need to be put in an institution so that they can get all the psychiatrist evaluations and put on therapy, then I believe the government should be more keen on doing that, because an accident like that, we can't just call it an accident. We just have to call it what it is. It's a negligence from the government and from the society. I'm being honest. We need to put more people in the office who will pass the right bills, and to make sure that society is protected from dangerous things like this, and that law enforcement are protected from serious mental illness patients that can be violent. But I don't even think that Beatrice planned for that to happen that day. The voices, when they come, they just come. So there should have been a psychiatrist, there should have been a GP, someone monitoring her taking her medications and going to therapy. Her fiancé even spoke about Beatrice being jealous of her speaking to one of his clients. No, she was jealous that he was being very nice and kind to one of his clients, and that could have possibly triggered up all these psychotic feelings and these voices that she was hearing and all. We don't know what did it, but something did it, definitely. And he said himself he's recovering from opioids, so I don't know if he was contributing to her mental illness, because he looks like he had bipolar himself, allegedly. And this is for entertainment purpose only. Guys, please like, share and subscribe. Have a lovely weekend and good night.